Great, thank you, Gabriella, and the organizers for the from Multiple Myeloma Canada for the invitation to speak. And unfortunately, it's not in person, of course. Everyone's dealing with this, and we're getting a lot of online time. So nice to meet you all virtually. I'll be speaking about integrative care in the context of multiple myeloma. Of course, through today, and as Gabriella mentioned, we'll have time, I think, good amount of time for some questions and discussions at the end. I have now no financial disclosures to declare, except for the fact that I run a integrative cancer center in Ottawa, Canada. So let's, I think there it's advancing. Okay, good. So really for today, I'm just going to be speaking about what integrative medicine is, sort of as a holistic approach to care in terms of cancer. And then we'll look at some of the evidence relating to some of the therapies that might be used in an integrative setting with multiple myeloma and to some degree MGUS and smoldering myeloma as well, and how that may have an impact on multiple myeloma. And hopefully spark some interest in integrative oncology as a possible adjunct to care and into the research as well. And certainly a frontier that's evolving and growing. And we're excited to be part of that. I do want to put out a note of thanks to a colleague and a research resident of mine at the OICC, Dr. Athanasios Sihogios. And he did some of the evidence-based review and provision of a number of the slides that you'll see here today. So just before we begin, this is really for educational purposes. These are not designed to be direct recommendations around what kind of integrative therapies to incorporate in care. Really does require the guidance from someone who's trained in integrative medicine, which could include an integrative functional medical doctor or a naturopathic doctor or a nurse practitioner who's has extra training in functional medicine. So really always good to discuss with your medical team what is right for you as an individual. So let's get going. I like starting off as well with a bit of a definition of terms. And complementary and alternative medicine, or CAM as it's known in the academic publications and how it's typically referred to, is really a very broad-based bucket that incorporates all kinds of different complementary and alternative medicines, anything from vitamin and supplement use, including homeopathy, to more advanced sort of integrate into injectable therapies and hyperthermia and things like that. So there's really a very, very broad spectrum of components that go into CAM, and I think that's important to consider in distinguishing what has value and what doesn't have value, and not to throw the entire thing out or to accept the entire thing either. It's really important to be discerning in the use of CAM. I do like to distinguish between alternative and complementary and integrative, where alternative really is something, is care that's not necessarily in opposition to, but often considered as instead of conventional care that one receive at the hospital. Complementary care is the sort of more common use of this therapy, which is where the CAM is used alongside conventional medicine, but without much dialogue, without much integration. And integrative, which is what we're trying to achieve with the OICC, is something that is much more in conjunction with and integrated with and in collaboration and in dialogue with conventional medicine at the hospital. And we're achieving that to some degree with certain oncologists in certain departments, but it's a work in progress, and there's a lot of questions and myths and misconceptions that exist around complementary and alternative medicine. And part of that reason, I would say, is that there is a vast array of sources through which people receive their information on complementary and alternative medicine. First picture is really at a health food store, where you might be getting advice from a retail seller who may not have any real training in the use of complementary medicine, but has been provided some information from industry that they can provide to you. There's something called The Truth About Cancer, which is sort of a docu-series that's out there. That's one of many that really points the finger at conventional medicine and suggests that there's sort of a conspiracy to keep people away from good curative complementary therapies. And it's interesting, there's some compelling bits to that information, but I think it's really important to take it with a very large grain of salt and really be, like I said, discerning in one's search, and not to be wary of where conventional medicine is disparaged as a result, and as a reason for using complementary medicine. There's talk show hosts that make a lot to say about complementary medicine, and of course there is Google and the entire internet, which is rife with all kinds of information and quite often misinformation as well. Some of the consequences of this misinformation is that patients may refuse, in fact, curative conventional treatments. They may do so based on the belief that it is harmful, or that there are natural cures that somehow they're not being provided, and if they search long enough, they will find this. So that's a concern. There could be the potential for a negative interaction with some of the conventional therapies. Could be immunotherapy or chemotherapy that could be perhaps affected by the use of some of the complementary medicine and the use of this misinformation. And that there's also obviously insignificant costs that can be incurred by pursuing ineffective CAM therapies. And just through all of this, the amount of information that one has to sift through and the hype that one gets exposed to can create some stress and anxiety as well. So these are all things to consider in your consumption of information. Integrative oncology, which is really integrative cancer care, is a field of cancer care that has been developing over the past 2 decades and really has a following of its own and a discipline of its own and a research base of its own, which is growing and interesting. And this is a definition that was published in the Journal of the National Cancer Institute, which is a well-known journal in the States, in 2017. That was done by a multidisciplinary group that involved oncologists, nurses, naturopathic doctors, patient advocates, that came together to put forward this definition of what integrative oncology is. And so the emphasis is mine in terms of the underlying and the bolding, but this is the definition as patient-centered, evidence-informed, that includes mind-body practices, natural products, and lifestyle modifications from different traditions. And I mean, different traditions could be Chinese medicine or Ayurvedic medicine or naturopathic medicine alongside conventional cancer treatments. And that this is, the goal is to really optimize health, the quality of life, and the clinical outcomes throughout the cancer care continuum, and to empower people as well throughout their treatment and beyond. So really, this is integrative oncology combines conventional with complementary medicine. It's not alternative care. The goal is to be evidence-based and evidence-informed and look to the evidence for guidance on what's the most useful in terms of care, and also to be holistic in its approach. So this is looking at not just the pathology of the disease, but the whole person. What is their mental makeup? What's their emotional makeup? What are the things that are contributing to how you feel? And that is a holistic approach, of course. And in addition, it's also multidisciplinary and multimodal. So you have lots of different tools that would be used within integrative oncology. It is patient-centered, very focused, and non-hierarchical in a sense, where the patient really has a lot to say from the decision-making standpoint about the kinds of care that they incorporate into their treatment plan. And as mentioned, it's across the spectrum, right from prevention to through palliative care and right up to the end of life care in certain scenarios as well. So it's not an alternative, as mentioned, but it's rather intended to support patients through a treatment. And it uses the best available evidence to make informed, good choices that is safe and efficacious, and does not promote natural cures to cancer, but rather works with the patient's care and their healthcare team to support their overall quality of life before and after treatment. So really the four main pillars that I see as critical to integrative oncology is the use of natural products in a judicious way, the use of nutrition and the kinds of foods that we bring into in our diet and what kind of effect this can have on our health. Our lifestyle, which includes exercise and stress reduction, and exercise and just different tools to help us live better, and then our mental, emotional, and social environments, and how do those contribute as well to our well-being. So the Ottawa Integrative Cancer Centre, I won't speak too much about us, but I did want to give a bit of a background. We are a resource for patients and for family members, and we have an active research department that is engaged in synthesis research, pulling together the research from the literature already, and compiling that in a way that's digestible and understandable for patients and also for healthcare practitioners. So it provides the evidence for why we use some of the therapies that we do. And then we're active in clinical research as well, often in conjunction with the Ottawa Hospital to do studies relating to integrative options for care. And we have got a few trials that we have underway. We're also here as an educational resource for the community and for healthcare practitioners and for students. And we've had a number of rotations of different healthcare practitioners come through the clinic. We are supported by the OICC Foundation, which is a registered charity. However, much of the services that we do provide are fee-for-service. We have some OHIP coverage for medical care, and then we do offer some subsidized care as well for our individual care and through programming as well, group programming. So some of the therapies that are available here and what we emphasize and are representative of integrative oncology is acupuncture and traditional Asian medicine, integrated medical care through our nurse practitioner and medical doctor, naturopathic medicine delivered by 4 naturopathic doctors who also do nutritional counseling. We have 2 massage therapists, a reflexologist and a craniosacral therapist, a physiotherapist and a personal trainer, and then we have a psychiatrist and a psychotherapist, 2 yoga therapists and a hypnotherapist as well. So quite a wide array, a diverse group of practitioners that are really excellent at what they do and can provide sort of that holistic integrative care for the patients that we see. So one of the key aspects I think is important to emphasize around integrative medicine is decision-making support, because going back to the issues of information that's available on the internet and throughout exposures from friends and family and whatnot, really making choices can be very, very, very challenging and anxiety-provoking and really be an overload. So that's one of the things that someone who's trained in this area can provide good supportive choices, good sort of logic and ask the right questions in terms of determining what makes sense, looking at cost, looking at safety, looking at possible for harm, for interactions with conventional care, all of that. And really, once you've got the information, you've been able to digest it well, then really it's the patient's choice to move forward and be empowered with that choice with confidence, and can always ask questions and always can change their mind. So regardless of whom you see, I think it's just really important to have that perspective. So building a solid foundation that does incorporate integrative medicine, we look at, like I mentioned, diet and nutrition, active lifestyle. We look at aspects related to psychological and emotional health, and this judicious use of natural health products. So targeted use of those in a way that is supportive. And this is alongside conventional care, and that can be supportive for both the patient and for the family as well. So I'm going to now dive in just to a few studies looking that explores some of the different pillars that I mentioned earlier in terms of supporting patients with multiple myeloma. And so we'll look from this perspective at from an exercise standpoint, we'll look at exercise in adults with blood cancers as a group, and then weight management and progression of MGUS, which is, of course, monoclonal gammopathy of unknown significance, but that also, I believe, we can reflect on as being relevant to anyone with multiple myeloma as well. So in this study, it's an interesting study, looked at aerobic physical exercise for adult patients with different types of blood-borne cancers, or hematological malignancies, any of the cancers that are of the blood, so lymphoma, leukemia, melanoma, multiple myeloma. And this is from a Cochrane review that was published in 2019. So this is really, it was an exploratory study, which is a systematic review pulling together studies that are available across the literature to see if aerobic exercise could be helpful, safe and feasible for adults with blood cancers. And so this study looked at 18 different studies. It combined a total of just under 2,000 people that were included in this review, and analyzed that, and included patients with different types of blood cancer, as I mentioned, leukemia, multiple myeloma, lymphoma, and also those that were recipients of stem cell transplant. Unfortunately, only one study reported on overall survival, and it found that there was no difference between those who exercised and those who did not. That said, 6 trials reported on how many people in the study were deceased at the end, but not directly looking at survival, and they found no significant difference between the groups. So the authors rate this finding as a low certainty. So the study itself projects that there's not enough research to say that exercise has an impact on survival or not. However, we look at studies right across other solid tumors. We see typically that exercise is. So I think that we're dealing with a low number of studies in this particular field. And I think that if we were to see more, we may see a difference. But there's no question that exercise has an effect on quality of life. And it certainly, in this, it showed that it does improve both depression and fatigue for patients, which are 2 major factors, obviously, that can have an impact on quality of life. And it's unclear just exactly how much that is. But so it was seen from this systematic review that it's likely to improve depression and fatigue, but it's unclear about how its effect on other quality of life measures. Nevertheless, exercise is something that we frequently recommend. Just being active, being out and moving has such an impact on sleep and in numerous other aspects of life. So in the second study, this is one that's looked at weight, and it looked at obesity and whether or not this had an effect on the transformation of MGUS to multiple myeloma. And this was a population-based cohort study. So this was an observational study. This was published in 2016. And really the goal was to see if obesity, which is really a BMI over 30, so not necessarily extremely highly morbidly obese, but obesity quite overweight, could be associated with progression of MGUS to multiple myeloma. And so this was an observational cohort. It followed a group of people over time, and it observed them for just under 6 years. And it looked at almost 8,000 patients who had a diagnosis of MGUS. And so of those 8,000 patients, 72 normal weight patients did progress to multiple myeloma, whereas 144 who were overweight and had a BMI over 30 progressed, and 113 obese patients progressed. So it's a significant difference between those two. And you can see that the hazard ratio is up to 1.98 So almost a twofold risk of developing multiple myeloma for those patients who were obese who had MGUS. And so clearly there seems to be an association here between being overweight at that time and this progression. So from a nutritional standpoint, so moving along, we're going to look at a couple of studies. One which again looks at the progression of MGUS to multiple myeloma, and then another one which looks at nutrition around stem cell transplants. So in the first study, this looked at dietary intake, and really the purpose of this study was to see if there was an association that existed between what people ate and the risk of this transition to multiple myeloma, and if diet affects this progression. So it was a retrospective observational study. So instead of where there's a retrospective, essentially it's just looking back in time. So it's looking back at a group of patients and trying to do an analysis of their dietary intake in that particular group, and then observing the risk that occurs and having an association as a result. So there are some challenges with this design, because there's always the possibility of having a recall bias and not really providing the information as clearly as it would be in a prospective study that's looking forward in time. So here the authors found that those who reported eating fruit, in fact, at least 3 times a week, had a significantly lower risk of progression from MGUS to multiple myeloma, and it compared to those who ate fruit less than 3 times a week. So there seems to be an association with protection with fruit consumption. Surprisingly, perhaps, there was no association with vegetables in this way, and normally vegetables are considered, even if anything, preferable over fruit, but really both vegetables and fruit are providing a rich array of antioxidants. And in any case, so this particular study did not see the association with vegetable intake, nor did it with dairy and meat. Did not seem to influence progression one way or the other, either for support or negative effect. So overall, it seems that fruit intake may influence the way that this type of cancer does progress. And it was observational, though, and fairly small. So no, I don't think we can make firm conclusions on this at this stage in terms of this cancer. That said, well, I'll talk a little bit more about the Mediterranean diet in a couple of slides, but we see that in other types of cancers, a Mediterranean diet and a diet that's considered low glycemic or low inflammatory may in fact have an association with improvement in terms of risk of recurrence and risk of development of progression. So in this second study, this looked at stem cell transplant and what the addition of actually a protein blend, which consisted of a soy and whey protein blend, so a mix of soy protein and dairy-based protein, could have on allogenic stem cell transplantation, so stem cell transplant using one's own stem cells, and looking at what impact it's had. So this was published in 2017. It was a randomized controlled trial, so it has less likelihood for any bias, and is considered one of the strongest design to determine causation. But this looked at this protein powder and to see if it helped with muscle mass and malnutrition in patients undergoing stem cell transplantation. And this study was conducted in leukemia patients who were going through stem cell transplant. So not the exact same, obviously not multiple myeloma, but similar concerns do present for patients with myeloma that are also undergoing stem cell transplantation. So I think we can generalize the results from this particular study in terms of improved muscle mass and muscle strength in that way. So for those that did not receive this protein blend, they did not have as much of they had more loss in terms of their muscle mass and their strength as well. And they had some lower markers of blood nutrition that looked at albumin, which is a protein that exists in the blood, which helps to retain the fluid in our blood and is a marker to some degree of malnutrition. So this is something that I think is important take home is to, to be well nourished in the context of a stem cell transplant, and to be looking at protein intake of 1 to 1.2 grams per kilogram at least. And it's interesting that the soy whey protein was used here. I think a whey protein would be fine if there's no dairy intolerance at all, but that's something to note.
Dr. Seely,
yeah,
just a small clarification. I think when we started talking about the transplant, the study was an allogeneic transplant, and so that would be when the stem cells are from someone else and not from your own. Just a
I'm sorry, I was reading autologous, and you're totally right. Thank you so much for that correction. Yeah, okay. Yes, thank you. In terms of nutritional choices, the basic sort of recommendations that I think can be used by anyone for supporting good health, and that could be from a cardiovascular standpoint, could be for diabetes, metabolic syndrome, and also for cancer, is really a more of a Mediterranean style diet. And actually, the Food Guide for Canada has really come out with some strong recommendations and good recommendations which are changed from where it was before. So really, this incorporates lots of vegetables and fruit, the use of white meat and fish in moderation, and whole grains, while avoiding excess red meat and refined grains and high-fat meals, ensuring plenty of fiber through whole grains, different types of vegetables, green leafy vegetables, lentils, beans, etc. And also regular yogurt consumption may be a positive addition to a healthy dietary pattern. And really, but not to have your diet provoke anxiety, I think is one of the biggest things that I often speak to with my patients is make some healthy choices, but don't be overcome by the need to fit the exact right formula. There's no perfect formula, but there are choices that can be made that are better as a whole. The science is certainly not so clear that we can say, beyond a shadow of a doubt, a particular dietary form is the right one. But there are certain principles, and that is fiber, lots of color in the diet, lots of vegetables in particular, fruit, whole grains, and animal proteins, and fat in moderation. So there's no magic, but it's not processed foods, and it's eating and cooking for yourselves, and just making choices in the grocery store where you are shopping for the whole foods and not for the processed foods by and large. Okay, so supplementation. There's a lot to say on this, and maybe we'll have some time for discussion and questions at the end. But I'm going to focus just on a couple in terms of studies that relate to multiple myeloma. And the reality is there's not a lot of studies that are focused on different integrative options in the context of multiple myeloma, because it's not one of the cancers that gets anywhere near as much research. And I'm sure you're all highly aware of that. But when it comes to integrative choices, where the research becomes even thinner, the amount of research for supplementation becomes even less. So a couple studies we'll look at, though, include one which looks at curcumin and MGUS and smoldering myeloma, and then one looks at vitamin D and vitamin D deficiency, which is a common observation, especially in Canada. So curcumin is a chemical. Curcuminoids are chemicals that occur in turmeric, which is one of the spices and root spices that we find in curry, and comes from the Indian subcontinent, and really has an incredibly high utilization rate there. And we actually see lower rates of certain cancers, which sort of propelled people to look at curcumin specifically as having anti-cancer potential. And we see across the board in so many different cancer types there seems to be an effect in terms of curcumin's role as an anti-cancer. Most of this research is preclinical. However, there is some clinical research that is developed and is coming forward, which is certainly promising. And it's a potent natural anti-inflammatory. It's one of my favorite supplements. So this study looks at MGUS and its conversion to multiple myeloma in RCT, looking at 4 grams of curcumin used in a crossover study, which then became an open label study, which was interesting. This was published in 2012. This is really to look at, see if curcumin changes markers for disease progression status. And as mentioned, it is an RCT. And but then as a result of some of the effects that we're seeing, they converted it to an open label study, which is interesting, with a higher dose as well. So the administration was 4 grams at the beginning, and then they transitioned that to 8 grams. And there did seem to be a modest effect on the marker of disease. In this case, it was free light chains and bone resorption that was found to be improved in this case. This was a small study, but it does present some preliminary evidence for future research that maybe curcumin could be helpful in terms of transition to multiple myeloma, and also even possibly in terms of anti-inflammatory management for multiple myeloma, but that's a bit of a stretch. It's certainly not a treatment that would replace anything conventionally, but could possibly have a role in a sort of more watchful waiting kind of a state. So vitamin D is the other one I would look at here, and vitamin D is not one that's been studied as far as it has as a supplement in a controlled clinical trial, but there's been a number of studies that have looked at vitamin D blood levels and serum status and prognosis and progression. And so in one study in 2009, there is a relatively, these are small studies, there's no question about it. 148 patients newly diagnosed with multiple myeloma went through testing for vitamin D, and it was found that those who had insufficiency, and a pretty frank insufficiency, I would say, less than 50 nanomolar, and the reference range for insufficiency is below 75, in fact, in Canada now. But they had, those that had this deficiency had a higher inflammatory status than those that were sufficient. And this was through looking at CRP, or C-reactive protein, which is a biomarker for inflammation. So looking at sort of, what is the inflammatory aspect of these patients, and what vitamin D could do in this case. In a much more recent study, in 41 patients with multiple myeloma that underwent this testing, those with deficiency actually had higher rates of neuropathy and a worse performance status overall. There's no association was found for stage. So really, in terms of vitamin D, again, in this particular cancer type, there's limited information to conclude that the effects of vitamin D will have, what effects they'll have on patients with MGUS or multiple myeloma. But we can say there may be a role in terms of controlling inflammation, and possibly, by inference, the potential for worsening of prognosis. I think it's important, though, for so many reasons overall, just to make sure that vitamin D levels are sufficient, and so that is at least a level of over 75 nanomolar. And I would like, I like to see patients in a realm between 100 and 150 nanomolar, which typically doesn't get achieved in Canada without supplementation. So there's probably a role for supplementation for vitamin D across the board. And it's unfortunate that this test is no longer available as a fully OHIP covered or government covered test, unfortunately, unless you've got specific criteria like history of rickets, or there's osteoporosis or something like that. But nevertheless, I think it's well worth testing and probably supplementing as well, especially in the winter months. So the question about natural health products, we just covered a smattering of these, and there are so many that are out there, and I think there are some with promise and deserve more study and more attention, and I think some can be applied in certain contexts for sure. But I think you can't assume that all natural health products are safe. Just because it's natural doesn't mean that it is in fact good for you. But typically, natural products have a pathway for being metabolized by the body that makes them, by and large, much safer as a whole than prescription medications, and that's why they're over the counter. But it doesn't mean necessarily that they're safe. And the issue of interaction is one that I think is important to consider, because certain therapies, particularly chemotherapy, may interact with some of these therapies. So it's important to consider that. There's also a lot of variety in terms of the quality of manufacturing of natural health products. Fortunately, in Canada, we have the Natural Health Products Directorate, which controls for quality to some degree, and there is a natural product number that you can see on virtually all the products that are available in Canada, so that they do have to go through a certain degree of quality control. And so compared to the United States, for example, the quality of the products with NPN numbers, we're assured of that much higher than those in the States, which is encouraging here at least. I do always recommend considering and consulting with a healthcare provider that's knowledgeable in natural products in terms of its use, and especially in the context of cancer control. So just some examples in terms of safety and the potential for interactions. This is from a natural medicines resource review, which looks at the literature in terms of potential for interactions. And thalidomide, for example, can interact negatively with AHCC, which is a mushroom compound. Can maybe interact negatively with astragalus as well, which is a Chinese herb that's used as an immune support. And with activated charcoal, actually many therapies you do not want to combine with activated charcoal, just because of the potential for it to stop absorption, in fact, of the drug. Bortezomib has known clear interactions with green tea, especially, and also potentially with vitamin A supplements. So it's one of the things to be aware of. Green tea may possibly have a role as well in early stages, but just be very cautious with the consumption with bortezomib. And then inotuzumab, which is another one of the monoclonal antibodies. An example is, again, green tea and alcohol-containing products. So these are just some examples of possible interactions. Last area that we'll look at is just support from the sort of mind-body medicine approach, and what effect can, deriving just a greater sense of equanimity and reducing one's stress. These are important things that can really help you to support better quality of life. And so we'll look at one study that looks at mindfulness in particular. And this was a meta-analysis, which is again a review of the literature. It pulled together 7 studies in this particular study review, and it looked at the effectiveness of mindfulness-based therapy for reducing anxiety and depression. And so this could include, mindfulness can include things like meditation, a focus on breath, focus on a particular sound or a mantra, and we wanted to see, the authors wanted to see if these therapies could have an effect on anxiety and depression. And so there is a program called Mindfulness-Based Stress Reduction, which was developed by John Kabat-Zinn, and it's a meditation-based form of therapy help to reduce stress and improve symptoms of anxiety and depression, among other mental health aspects as well. And this review found that overall, patients with cancer who partake in in this mindfulness practice significantly reduce their symptoms for both depression and anxiety. So it's always something that I do talk to patients about, is what brings you joy? You know, what is it that gives you a sense of equanimity? And it doesn't have to be mindfulness or meditation. It could be, you know, simply going for a walk in nature and not stopping on park benches right now, unfortunately, because that'll give a very stressful high ticket rate. But to be able to, you know, to be in nature, or to listen to music, or to do some exercise, whatever it is that gives one peace and relaxation, is such an important part to not forget about. So a couple of special topics, just the role of IGF-1 and insulin. We'll look at this just briefly. Insulin-like growth factor is an essential part of normal metabolism, but dysregulation of this this growth factor has been associated with different types of cancer. And so there may be a possibility in IGF-1 promotion, and that can be controlled perhaps a little bit with diet and staying away from high glycemic diets. So diets that are high in carbohydrates, simple carbohydrates especially, and sugar, as a way of trying to control IGF-1, because it is provoked by higher blood sugars and an insulin response. So there is some preliminary data that should suggest that IGF-1 may be involved in the homing process, which may attract multiple myeloma cells into the bone marrow, and in fact, even in the stimulation proliferation of these cells. So it's almost like a hormonal effect, like estrogen for breast cancers. Possibly IGF-1 may have a similar role in this way. And it's also, it leads to dysregulations in the normal process of cell death as well. And it can also contribute to drug resistance and the development of angiogenesis, which is new malignant blood vessels. So something to consider as well. So there's one clinical trial that did explore a new drug to target IGF-1 in relapsed multiple myeloma patients. And this, again, looked at a small number, but it combined bortezomib and a new drug that does target IGF-1. Now, it's not, it didn't find that there was a specific change in this, unfortunately, but I think this is something that we'll see potentially develop further in the future as well. So just some red flags when it comes to complementary and alternative medicine choices. I think it's really be very cautious of any claims for miracle cures, for any things that are, you know, that if you don't do that therapy, you know, you risk potential harm, and there's a lot of that out there. So I think that's important. Look at the source and look at the references to research. If there's no reference to research and it's all anecdote and it's hyperbole, then that's something that you need to, you know, be cautious of. It may, if it sounds too good to be true, it probably is. There's always the grab your attention, clickbait kind of information that's out there. There should be a discussion of both the strengths and limitations of what the recommendations are, and that's you know, these are the things to look out for. And just looking at research, if you do get into exploring research on your own, look for reputable sites. And there is Memorial Sloan Cancer Center has a good site. There's examine.com. There is the Beyond Conventional Cancer Therapies is another good resource. I'm sorry I didn't put this up here, but those are good resources, and healthcare practitioners that are knowledgeable as well. And really try to get more than one opinion rather than just relying on one source. So I guess that takes me to the end of the talk, and I think we do have some time for questions and discussion. And so I guess I'll pass it to you, Gabrielle.
Thanks, Dr. Seely. That was excellent. So we do have some questions that did come in.
Great.
The first one here has to do with a lot of myeloma patients are, while on treatment, they're given either antibiotics or antiviral therapies, for example, to protect against something like the shingles. Are there any natural alternatives to those types of, I guess, medications?
It's a great question. I think nothing that you could say is as strong as, say, acyclovir. It would be an example for a conventional treatment approach to prevent shingles. There is like for this particular type of virus, there may be a role of lysine, which is an amino acid, in terms of controlling the rate of replication. These viruses don't like lysine very much, whereas they do like arginine. So having a diet, not with a lot of chocolate, I think is one thing to avoid. Red meat as well, but and then possibly the use of lysine as an amino acid. But long-term use of any amino acid in isolation can cause deficiencies, sort of relative deficiencies in others. But if you're looking at 1 to 2 grams potentially on an empty stomach, maybe with some vitamin C and some zinc, that possibly can have a role as well. But if the recommendation is strong for acyclovir or a conventional antiviral, then I'd probably go with that.
All right, thank you. We talked a little bit about diet, and there's information out there that that cancer feeds off of sugar. So what can you say about diet, sugar, and cancer?
Yeah, it's a question I get all the time, and I think there is some real truth to the fact that sugar can in fact contribute to a lot of sugar can potentially contribute to progression of disease, and it's whether it has any role from a causation standpoint, I think is much less known. However, there's definitely a higher utilization by many cancer types of glucose as a preferred fuel. So that's one aspect of the possibility that sugar feeds cancer, and I'm putting air quotes in. Cancer cells are very effective at deriving energy through whatever means they may need, and they can derive energy from amino acids as well, but glucose or sugar is the preferred source typically. So having a diet that is high in sugar, I think, is not a good idea from that standpoint. You're just providing a very easily, readily available fuel. But the other aspect of sugar is that it does contribute to inflammation in the system. And it also contributes to this insulin response and this provocation of insulin-like growth factors. So my recommendation is not complete avoidance, and I don't think we know yet enough that, say a ketogenic, which is completely sugar or carb avoidant type diet, I don't think we know enough yet that there's not enough data to suggest that that's really preventative or can control cancer. I think there's been some hope around that, but it's not really being panning out. That said, having a diet that is what I would consider lower glycemic, more Mediterranean, not having heavy consumption of starches like potato, rice, bread, pasta, and so having those carbs in moderation and having it with foods that are high in fiber, high in fat, will reduce that glycemic effect of the food. So it reduces the blood sugar blood sugar contributing effect, and reduces that insulin-like hormonal effect as well. So so long answer, but I don't think you need to be afraid of the occasional treat. But I think overall, for all kinds of health reasons, avoiding high sugar in the diet is totally the right choice.
Okay, thank you. We had a few questions on mistletoe as a supplement, and I mean I have some questions on a few of them, but let's start with mistletoe. What can you say about mistletoe?
Yeah, so mistletoe we actually use relatively frequently here, and I am a proponent for the use of mistletoe in certain cases. I think as far as control of the disease, there's really very little study on multiple myeloma and mistletoe. There are studies in breast cancer, there's studies in other types of solid tumors, but the idea is that it's going to provoke an immune response and also create a process called apoptosis, or programmed cell death in cancer cells. And this has been shown in preclinical studies to definitely be the case. There's also been quite a few studies that look at mistletoe in conjunction with chemotherapy to reduce the side effects. And these are in randomized controlled trials. And it does seem to have an effect in terms of improving quality of life. And I'll see that in clinic. In terms of control of the disease itself, there is some promising research around this. We have a monograph actually that's recently been updated on our website. I think there is some real possibility that this does contribute to longer term improved outcomes, but we don't have strong data to say that at this stage. But if we're looking at some of the preclinical models and some of the human data, yes, it is suggesting that, but I don't have any data in multiple myeloma that I can point to that says that.
All right, thank you. The next two questions have to do with alcohol, and one has to do with on one of the slides you had alcohol and bortezomib as possibly being something that has an interaction. And so this question simply, the first question is simply, we're using a lot of hand sanitizer these days. Should there be any concern about that for someone who's on bortezomib?
No, interesting question. There's no real absorption through the skin of the alcohol that would have any concern from this standpoint.
Okay, and the next one has to do with the, we talk a lot about moderation, and so what would be, I'd say, an acceptable or healthy amount of alcohol that someone with myeloma that's on treatment would be able to potentially consume?
Yeah, you're probably looking at, I mean, the studies aren't very clear on this, but there does seem to be an association with alcohol and cancer risk, and I would put cancer progression in there, and then you've got the added aspect of the medication as well. So moderation to me would be not much more than a 4 to 6 ounce glass of wine, kind of one drink per sitting. Possibly for a larger person, they could maybe have 2, but typically, like the recommendations for low risk for men is up to two glasses in a sitting, and for women for 1 in a sitting.
All right, thank you.
Gabriella, just one clarification I wanted to make around the mistletoe is mentioned as a supplement. It's definitely shouldn't be used as an oral agent ever. The berries of mistletoe can be hepatotoxic, liver toxic, so it's only used as an injectable format, which does not have that effect. So I just wanted to clarify that.
Great, thank you. Next question is, some people for anxiety might be taking some stuff like lorazepam. Are there any alternative natural ways we can deal with anxiety?
Yeah, definitely from, I would go back to mindfulness and meditation and ways to try to get into a relaxed parasympathetic state. So that can be incredibly helpful to try to create the environment that doesn't nourish anxiety. And that, in the context of today, could be not listening to the news too often, staying away from certain social media feeds, and also just creating and cultivating time for oneself where it is, purely just peaceful and reading a book, whatever that may be. So from a behavioral standpoint, that's, my first place to go to. Sleeping well is also critical. If you're not sleeping well, the tendency towards anxiety increases, and stresses are more, you have less resilience to stress. So sleeping well is really important, and exercise. These foundational components of health cannot be overstressed. when it comes to natural therapies for anxiety, yes, there are certain ones. Lavender may have a role. Teas like chamomile tea can even be quite a nice soothing, relaxing agent. Things like melatonin at night can sometimes be. GABA can be supportive. Theanine is another one. So there's a variety of possible tools that are there that can be supportive for anxiety.
Thank you. Next, well, we had a few questions on CBD, so cannabis oil or Rick Simpson oil and
Right.
stuff. Yeah. So what can you say about that?
Yeah, I mean, the evidence is not really strongly in as far as the role of cannabis in terms of cancer control itself. In glioma, which is a form of brain cancer, there seems to be some more promising evidence that's coming out that's suggesting that it may have a role. But we don't, it's in early days for the evidence around that. That said, cannabis I've seen to be incredibly helpful, and we're talking about anxiety, actually can be helpful in anxiety, especially the CBD, which is the non-psychoactive component of cannabis, whereas THC is the more sort of psychoactive, the ingredient that we know can get people high or stoned or whatever. But CBD doesn't seem to have that effect. They can also be, in combination, can be helpful for pain management and for appetite stimulation. So those are sometimes they can be helpful. Our nurse practitioner here will actually prescribe medical cannabis, which I think is, you can get a reliable source, you know exactly what the constituents are, and depending on the condition that is being sought to treat or to support, different strains really can have different effects, and not just in terms of the proportion of THC to CBD. So there's other, terpenoids and triterpenes and other things that have a role to play in how cannabis interacts in the body. But I'm a proponent of cannabis use when it's used for the right approach. I'm cautious about things like Rick Simpson's oil or others that you can get on the sort of open market, not necessarily black market anymore, but open market, because you really don't know how it's being produced, if there's pesticides in it, if it's being manufactured with a lot of plastics. So having a good source, I think, and knowing what you're getting is appropriate.
Awesome, thank you. I mean, we've reached 2 o'clock, but I do still have a few questions. You're okay to stay on for just a bit longer?
Yeah, I'm fine. Yeah.
So for the people who can't stay on and listen to the rest of it, I'll remind you that this session is recorded and it will be posted on our YouTube channel. So if you've asked a question, we'll try to get to it. We might not be able to get to all the questions, but I'll try to do as many as I can. So the next question here has to do with what can help with bone pain. Is it exercise? Is it stuff like acupuncture? How can help with that?
So I've seen acupuncture really have a remarkable effect on pain and bone pain. There sometimes can be some anti-inflammatories that may have a role in that as well. But yes, exercise can have an impact on pain and our perception of it and management of it. So, but I think some of the physical therapies can be remarkably helpful. And yeah, I mean, our acupuncturist he does when he's not seeing anyone now, unfortunately, because we're in a place of only doing telemedicine. But I've seen phenomenal results, and I think there's a lot of good acupuncturists around. So finding a good referral to someone, I think it can be very helpful. Massage therapy can be helpful as well, but yeah, and sometimes there are certain oral agents, and also even yoga therapy and meditation can help in that way too. So there's ways of getting at it. Don't give up, and actually cannabis can be helpful in that way as well.
Great, thanks. So next question. Something like a stem cell transplant in some women could could potentially result in early menopause. And so we have a question here about bioidentical hormone replacement therapy.
Yeah, I personally don't do that myself. I know a couple of my colleagues do that here, but I think it can be helpful in terms of managing some of the side effects, well, early menopause. So yeah, I see it as a viable approach. And hormone replacement therapy, I think, has, at one point really had a very negative spin in terms of the potential for breast cancer induction. I think it's not as, it becomes a question of balancing quality of life and age and risk, all of those things. So having a solid discussion about, does hormone replacement make sense, I think is a good consideration. Just in terms of symptom management, though, I would say, for hot flashes, again, acupuncture can be remarkably helpful. So too can certain natural agents that can be helpful as well, that are, natural health products that can manage hot flashes more effectively.
Thank you. So back into some people asking questions about supplements. So what about CoQ10? How can that help, if at all?
Well, CoQ10 is normally considered a supplement useful for heart function and sometimes maybe for energy as well. So I'll use it possibly post anthracycline therapy, which is cardiotoxic. I wouldn't use it during chemotherapy because it is a relatively potent antioxidant, but it may have a role in cardiotoxicity, and there's some data that suggests that that is the case. Yeah, beyond that, I don't see it as a strong, anti-cancer therapy, but it really is cardiac related.
So okay, so thanks for that. So now we have, I guess, a comment about massage therapy. Someone who wants to get massage therapy, how important is it for for them to inform their doctor or the massage therapist about their condition, and perhaps that they have fragile bones, and so should these types of therapies only be done by people who have experience with let's say cancer patients?
So if there is a significant lytic lesions and one is on possibly medications for bone loss, and there is a high risk of fracture, then I think it's imperative that the massage therapist is very much aware of that and applies the right pressure and whatnot around that. If it's an earlier stage and there's not that kind of a situation and there's much lower risk of fracture, then there's been a bit of a myth around the issue of massage therapy by moving the tissue and the lymph is going to spread the disease. I don't think there's any real data to suggest that's the case, and it does help people get into a more relaxed state, feel better physically, probably more able to do physical exercise as a result. So I think massage therapy can be a wonderful adjunct, and I think just noting how it feels for you. But at the same time, you might not want to go to that massage therapist that applies an incredible amount of pressure that's maybe on one of the long bones. So I think using common sense in this, but not to be fearful of it, is important as well.
Fantastic. So all I have here are a few more questions on supplements. So I have vitamin B12, vitamin K2, codfish liver oil, and vitamin C. And that would probably be the end of it. So I don't know which one you want to start with.
So B12, I think if there is a deficiency or the diet is one that's vegan, for example, and doesn't have B12 in it, then it's probably important to do some supplementation of B12, maybe with folic acid as well. But B12, you can have a diet devoid of that if it is vegan, for example. That said, if I wouldn't use B12 just normally, because unless there is a clear deficiency or a dietary need, because B12 possibly it has an epigenetic effect, and it's unknown how much risk there is associated with B12, but there may possibly be some association with expression of oncogenes with the use of B12. So I'm less of an advocate for use of B12 unless it's necessary. Okay, so vitamin C was another one that was asked for about. Vitamin C can actually be useful in terms of connective tissue support, and that includes bones health, and cancer patients often are deficient in vitamin C, and vitamin C has a role in neutrophil activity and immune function. And so if you're not getting a diet that's rich in vitamin C, which is what we're designed for, then supplementation at a small amount may be warranted. High dosings of vitamin C is something that I wouldn't use in conjunction with chemotherapy, just because it is an antioxidant and it possibly might interfere with the chemotherapy, without getting into the specifics of which one. But but a moderate amount of vitamin C, 100 to 200 milligrams is not going to really cause an issue in terms of that, and maybe providing some sufficiency to the body and to the immune function. What were the other ones?
So K2, vitamin K2.
So, yeah, K2 has a role to play in calcium metabolism, and probably with vitamin D is not a bad thing to supplement with. It's not really toxic. Vitamin D in excess can be toxic, and same with most fat-soluble vitamins, but the K2 in moderation with vitamin D would be fine, especially where there's bone loss issues. And what was the other one?
So the last, well, we're going to finish off with two of them. So cod or fish liver oil.
Oh, right. Okay. Yeah. So fish oils are sort of considered anti-inflammatory and have omega-3 fatty acids, and I think can be quite helpful in terms of cardiovascular disease risk and health, and to some degree potentially as an anti-inflammatory for cancer as well, possibly for pain management. Not that everyone needs to be having this. If you've got a diet that's rich in fish, fatty fish and deep sea fish especially, then probably much less of an issue, and less of an issue if there's not much consumption of red meat or foods that are high in omega-6s. But but cod liver oil and it's I think looking at the purity is important, and so often a filtered fish oil is probably a preferable route, or krill oil is an option too, but depends on the dose that you're trying to achieve. Yeah.
Thank you. So the last question, we're going to end here with this one. So what can you say about coffee and caffeine? Is it more beneficial, or is it harmful in any way?
Yeah, so coffee is interesting. There's some studies that show that it's protective, in fact, for some of the cancers like colorectal and pancreatic cancer. And that's at a relatively high consumption. So I don't see coffee as a bad drink or as a vice, unless it's creating anxiety or it's creating insomnia. And so, if you drink coffee and you enjoy it and it doesn't seem to have any negative effects, enjoy it all the more, I would say. Yeah, it's got some, yeah, it may have some beneficial properties. So I'm not against caffeine unless it has a clear negative effect in the person, and usually that person knows it.
Awesome, thank you. So with that, that ends our session today. Dr. Seely, thanks again for taking the time out of your schedule to present to us this afternoon. Lots of information, I'm sure. As I mentioned, the session is recorded, so the people on this webinar would be able to come and revisit all of the information that you've presented. So thanks again, and have yourself a wonderful afternoon and evening.
Great, thank you very much. Bye for now.
Bye-bye.